Good morning, everyone. Buenos dias. I am excited to be here with all of you, finally in person, right? Awesome. So today, I am happy to introduce Dr. Sergio Aguilar-Gaxiola, the founding director of UC Davis Center for Reducing Health Disparities and the director of the Community Engagement Program at the Clinical and Translational Research Center. Dr. Aguilar-Gaxiola has dedicated his career to identifying and addressing the unmet mental healthcare needs of underserved populations. He has pioneered treatment models that recognize the unique cultural and linguistic needs of different populations, work that has been crucial to bridging disparities in care, particularly for Latinos and rural communities. His reach, can you lower?
I'm sorry.
Yeah, no. His reach, his research has identified depression as the most common mental health disability affecting Latinos and found that 3/4 of Latinos of Mexican origin with diagnosable mental health conditions go without treatment. He is a leader in promoting innovative models of integrated mental and physical health care for communities of color. Dr. Aguilar-Gaxiola has extensive experience in the developmental disability community as well, from being a family member and also serving on the Senate Select Committee on Autism as the co-chair of its task force on equity and diversity for Regional Center Autism Services. So please join me in welcoming Dr. Sergio Aguilar-Gaxiola.
Boy, I move. And I'm also not only happy to be here, but deeply honored to be among all of you and very grateful to Judy for this very kind invitation. And I'm with, I feel very strongly that I'm with family. You are family. And it's just very inspiring to me to see the incredible diversity that I see in the room. I move. So I'm gonna be sharing with you some of my own personal and professional journey, a journey that continues. And even though I'm going to be speaking, can you hear me? Yeah, I'm going to be speaking about what you see in the slide, advancing equity, and I'm going to focus particularly with people with developmental disabilities. But I want to share with you a little bit about my personal journey. This is part of my family. On my left there is my beloved wife and our wonderful son, Alex, who was, thanks to my wife, was diagnosed at age 5 with Asperger's syndrome. And then to his left, to his right, is our youngest son, Roberto, who has been incredibly present in this journey. And we have decided as a family to share our story, how we have been, working with my son's condition. And he's incredibly graceful. He's a blessing, graceful, sharing with different audiences. So we have decided a few years ago to be sharing the story with audiences like you, audiences primarily of anyone who has been touched by any kind of developmental disabilities. So this is something that we did at the Mind Institute back in 2015. And there is a very long video. It went way beyond certainly the 30 minutes that I have here. It was over 2 hours, but boy, from time to time, I watched the video and I continue to be incredibly inspired by my son, especially, and by my family members. We did it in English. The previous one was in Spanish. We did it also in English. And this is my Alex. And this is him. And this is him with the youngest sibling, Roberto. And this is him. And Alex is incredibly talented. Since he was a little boy, he started he started drawing with animation. Actually, I'm very impressed with him because he had the perseverance, the determination to train at the California Institute for the Arts, which helped him tremendously with his art. This is, he drew that, and it is him, in so many different circumstances. This is him. He loves to, there are so many stories that I can tell you that are, at least to me, incredibly inspiring. This is him as well. This is him. When we were sharing back in February of 2015, along with my family. This is my family, wonderful family. We have 4 kids. We have 5 grandkids. And the one on my wife's right hand is our oldest son, Sergio. And I love this picture. I just couldn't not show it to you, because this is Alex. Alex is a happy. He's 34 now, and boy, what a joy to be with him. Has been an incredible asset. Has transformed our lives, and has transformed many other people's lives as well. This is what disabilities do. That touches so deeply that we can collectively transform other people's lives as well, not only ours, at other people's lives. So now the professional stuff. Back in 2011, Alex Arembo, Los Angeles Times released these 4 articles bringing attention to the inequities in developmental disabilities. He focused more on autism, but it was an incredible contribution because it triggered many things that, were at the state level very powerful and connected to changes in policy, for example. And the idea was to do changes in practice as well, and to address the inequities that were documented in this 4 series. I'm so pleased that you are here, Emily. That's great. Thank you so much for doing that. So this, for me, it was a pivotal moment, and for other people as well. Miguel mentions a little bit of my background. Thank you, Miguel, for doing that. And that I was invited to be a part of this task force that was put by at that time, the Speaker of the Senate, Senator Darrell Steinberg, now the mayor of Sacramento. And along with another colleague, Arriba Martin, we co-chaired this incredible task force with so many people at the state level and national level as well. And we call it a report on the task force on equity and diversity for regional center autism services. And there are a few, these are some of the recommendations that are focused on the regional centers. There is another slide focused on recommendations to the Department of Developmental Services that I will share very briefly. And the ones that I'm going to highlight are that the regional centers are to provide information in a culturally and linguistically competent manner, to provide culturally and linguistically competent services characterized by flexibility and creativity, which, boy, I don't know any group that is more creative than those with developmental disabilities. Also, that the regional centers and strategic plans should achieve equity and cultural and linguistic competence. And please pay attention to achieve. I'm more more realistic, I guess. And I speak about advance, because it's very difficult to achieve. And finally, receive appropriate funding and resources. And this has happened. Judy, who is an incredible source on all disabilities, she has kept me updated on the funding side. And it's remarkable how the funding for regional centers has increased. And I wanted to emphasize that. These are some of the recommendations of the Equity and Diversity Report for the role of, once again, the Department of Developmental Services. And I'm gonna just emphasize a few of them. Provide standards on equity and cultural linguistic competency, to provide uniform data collection, analysis, evaluation, transparency, and oversight. Establish a culture that promotes equity, fairness, and diversity, very, very appropriate for our times, isn't it? And you remark about that, Judy, and I applaud that you did that. Also, to establish performance measures and indicators. because we want to know if we are able to move the needle, don't we? You know, we really want to have evidence that it is possible to advance equity. So some of the lessons that we learned through that journey were, and I want to share them with you, are that these are some factors and considerations in legislative initiatives. Consumers, parents, families, and workers must be involved. We all collectively need to be involved. The solution should be clearly identified. The solution should be reasonable and feasible to implement. The solution should have outcomes, monitored and measured, so we know if we are moving the needle. Potential to affect broad system change. It is not just in one, let's say, regional center, but this really spreads across the system. The state should have a clear role and responsibility. And the most important lesson that we have is that there is a significant number of champions who are passionate, dedicated, and devoted to improving the lives of children and adults with disabilities and their families. And that is you. And that is me as well. It is us. And so I cannot tell you, you know, how really happy and honored I am to be here among you and to see familiar faces, but to meet new friends, you know, new faces as well. Judy shared with me the report that was released a couple of years ago on a matter of race and place. And it's a remarkable report. If you haven't seen it, it documents with hard data, you know, the issues about inequities in access to care and inequities to the quality of the care that those in need receive. And she presented, this report has a couple of diagrams that I want, it captures actually something that we have known for so long. And the one on the right, the table, which has primarily red print, it is about disparities that have been worsened and the increased gap between white and Latinos, for example. Not much progress has been done. And in the columns you have, this is since 2015 all the way through 2021. We still have a lot of progress to do. And these meetings, I mean, a meeting like this can help tremendously to advance what we would like, we are committed to, we persevere in advancing. So there is a series of recommendations, but instead of reading them to you or sharing them with you, I would encourage you, please take a look at the report. It is an excellent report. And it is, the one that I'm gonna just highlight here is that one of the recommendations, monitor whether underserved communities are actually accessing recently restored and new services which were put in place to reduce disparities. So one of the questions that I have been grappling with for quite some time now, actually for decades, is it possible to advance health and mental health equity, especially with people with mental disabilities, developmental disabilities, including mental disabilities. And, you know, how do we go about doing that? And Judy knows about the work that we have done addressing disabilities. You know, in our wonderful discussions, you encouraged me, Judy, to present some work that we have done. And I'm going to share for the next few minutes work that we did in Solano County, which asked our center back in 2014, 10 years ago, if we could help transform mental health service delivery, because they had historically underserved communities in the county. And they asked us, can you focus on Latinos, on Filipinos, and on LGBTQ? And our center happily did that. And this is the name of the project that the community members and the county decided to call it. It didn't come from us, because we were there to listen attentively, and to act on what we were hearing, okay? So this is the interdisciplinary collaboration and cultural transformation model. Actually, it was 5.5 years of funding, although we work without funding as well. And it is anchored on the cultural linguistically appropriate services standards. I don't know if you're familiar with the class standards, but these standards were released in 2001. And these are very well incorporated in transforming systems of care. And they are at the heart of equity issues. So if you haven't, how many of you are familiar with the class standards? Okay, this is the audience that I want to speak to. So one thing that we did was to combine that with meaningful community engagement, which I'll talk a little bit about that as well. We met with the leadership of Solano County back in 2014, and they asked us if we could help. We loved the idea. We said, of course, we will help. And they said, can you tell us what you can do? And we decided to be as simple as possible, but in a way that we were hoping was going to be profound. So we recommended these 3 stages. First, to listen people who were, especially, they asked us to focus on Latinos, Filipinos, and LGBTQ. And that's what we did through comprehensive, for example, we did many, what we call key informant interviews. We did a bunch of focus groups. We did community forums with each of those 3 populations primarily, and others as well. There was no exclusion in what we did. The second phase is the development and facilitation of Solano specific class training, because we had been using the class standards in our center. We got funding from the developers of the class standards out of the Office of Health Equity or at the Department of Health and Human Services, funding that was given to California. And they funded us for 4 years to develop a toolkit on how to train on the class standards. So we have been doing this for quite some time. We had manuals, we have trainings that we have given. We now have a class academy to train, groups that need training. The last one, the last phase is to develop culturally linguistically relevant quality improvement plans. We call them action plans, designed to improve mental health service delivery that were both community informed and community developed. This was driven by the community. And therefore, it was of critical importance for us to listen carefully to what their needs were. And these are the 3 community-based organizations that we work so closely with. Solano Pride Center, which focuses on LGBTQ. Fighting Back Partnership focuses on Filipinos out of Vallejo. And also Rio Vista Care focuses on Latinos. And this is a complicated slide, but I just wanted to give you a sense about what is it that we did for the intervention, okay? Once we develop what we call the community narratives, by listening to those that we needed to learn from, we did the trainings, which was the intervention basically. So we have this curriculum that we have developed throughout the years and refined throughout the years, which is very intense. These are very intense trainings, 4 hours each of the 4 sessions that you see here, starting with an overview about health disparities, community needs and gaps, to train the participants on class standards, to the development of quality improvement plans or action plans, and then coaching. So I'm going to give you a little bit of a flavor of what that looked like. But I want to emphasize also that we developed this toolkit curriculum that we call providing quality care with class. And class, of course, refers to the cultural linguistically appropriate services standards. This is a little bit of what happened in the meetings. We trained 3 cohorts with over 50 people who participated and who made the things happen themselves. And they came up with 14 quality improvement action plans. You will see them here. Some of them community focus, CBO defined, workforce focus, and training focus. And these are the names that the participants in these trainings decided to give the action plans, like taking class to school. This was very, very impactful because it made it to the legislators. And the legislators provided funding for wellness centers, focus, for example, youth focus and older adult focus as well. This is another one of the action plans. The developers decided to call it ICU because I have seen it. People with developmental disabilities are not seen. And we need whomever is involved in the services to be trained to see people, okay? And to treat us with dignity, with respect, and also as an asset, as we are. And I mentioned that. I'm going to share with you just a couple of outcomes, even though there are many more outcomes. And one outcome is that there was a significant increase to the access line calls for example, with the LGBTQ, over 300% increase in the 5 years that we implemented this project. Also, 32% increase in Filipinos, 41% increase in Latinos. And let me tell you one thing very quickly to let you know is that we saw in real time how the access to services were increasing. But I just need to tell you how, policies matter. During the previous administration, when the public charge was released, it really had an impact on those who were accessing services in an increased manner. And we saw a dip because people were scared about using services. So what you mentioned this morning, Judy, I applaud you because I think that we need to be aware and we need to be mindful and ready, on how we are going to counteract that. So this is another outcome, which the county was very happy because these three people, these three areas, these three areas were using services through crisis intervention. And what we changed it was to outpatient services. And these trends reflected increased trust. This is the report. We were recognized at the national level with a community award. And we extended that statewide. So we trained 2 cohorts of representatives of over 41 counties, 41 counties, over 160 people that trained them for a full year, okay, with monthly meetings. So is it possible to transform systems of care? Yes, it can. And I think that we collectively can make that happen. That is the message that I want to leave with you, that you matter and that you can make a difference. And you are making a difference. I have no question about that. So I'm delighted to be here. And my hope is that the Master Plan for Developmental Disabilities that makes an emphasis on community engagement, that we make that accountable, collectively. So many people to acknowledge, and thank you so much for this great opportunity to be with you. Loves to you and blessings to you.
Next, we